Hi, everyone, and welcome back to the Queer Pridecast. Today, we're diving into a headline that's been impossible to ignore: the sudden spike in HIV cases in the Philippines. In early 2025, this year, reports said that we were seeing around 57 new HIV cases a day. So, some media outlets called it a youth epidemic, even reporting on children as young as 12 being diagnosed. There's panic, there's blame, there's a lot of misinformation. But here's what often gets missed: these numbers don't mean the problem just began. It means more people are finally getting tested, and that's a good thing. So today we're cutting through the stigma and confusion and bringing in two brilliant guests to help us make sense of it all. First, we're joined by Angelo De Castro. Mark is a development worker and strategy manager at Sustain Health Initiatives of the Philippines, or SHIP. SHIP is a global fund sub-recipient implementing HIV programs in the Philippines. He led the rollout of their cookbook toolkit, a differentiated service delivery model that brings HIV testing closer to communities. He just presented this work at an international conference in Tokyo, and he's here to talk about what structural change in HIV response really looks like. We also have Rod Olete with us. Rod is a public health nurse, researcher, and advocate who's currently pursuing his PhD in public health in Taiwan. He helped design hashtag telePrEPph, a program that makes PrEP more accessible for Filipino LGBTQ plus people. He also recently presented research work on behavioral profiles in PrEP users and on integrating psychosocial support for people living with HIV. Together, Mark and Rod will help us unpack the data, the policy gaps, and most importantly, the human stories behind these headlines. So, hi, Rod. Hi, Mark. How are you?
Hey, Evan. It's nice to be here. Thank you for inviting us.
Thank you as well for agreeing to this interview. So, first question for the both of you. We saw that there's been a lot of alarming coverage recently about the rise of HIV cases. So some point out that it affects like the queer people, youth, and even dating apps as causes. So from your perspective, has this kind of reporting contributed to new forms of stigma or reinforced old ones against the queer community? Do you think this is a bad thing, how HIV is being reported, how the HIV cases are being reported, to how the queer community in the Philippines is currently perceived?
Want to go for it first, Mark?
Yeah, sige ako muna. So actually, just to put things in perspective, we've been saying that one of the main reasons why there's an increase is because we have more testing, which is true. Also considering like if we're going to compare it with the bandwidth of internet from the time when we had dial up to now that we have fiber 5G internet connection, there's more data that you can download because it's more accessible right now. So that is true. However, it is also true that the epidemic is present. So not to overly dilute the situation, but I think the reason why several of the service providers, particularly the advocates of LGBTQ rights, are talking about, oh, this one big reason is because of the increase in services, is to remove that possible and potential stigma that comes along. Because the statement mentioned about men having sex with men, even mentioning that it is no longer the female sex workers. So in a way, indirectly, it is somehow targeting to the particular population. So anecdotally, maybe if we will look deeper into it, we'll find how much it has affected and pushed back all the wins that we had in terms of fighting for to ensure that it's no longer something to be feared. But with statements like these, especially we capture only sound bites and they are being posted online. It is much easier to share your comments and your information, your personal thoughts. So the problem with that is these sound bites only capture around few seconds of the information, and that's when people will have their own biased opinions about what happened. So, yeah, it's true that the numbers are increasing. Yes, there definitely is an effect on how this negatively affects the community of the LGBTQ here in the Philippines. But it's also true that we have gained more access for people to get tested.
Siguro, from my end naman, communication and phrasing of the right word really plays a very important role in removing the stigma when it comes to breaking the news sa Pilipinas. A lot of news outlet are phrasing it in a way that it sensationalizes HIV because it gains more traction from the social media, from the internet. But at the same time, it's also placing a lot of stigma on the part of the queer community. So this is the part where we should, as advocate, we should be calling out a news media outlet and also to at least introduce several sensitivity training, maybe and the right
Mm-hmm.
use of person-centered languages when it comes to HIV care. Because HIV, when it comes to language and communication, we in the advocacy and the community, we know what language to use. But then it's really high time to share these proper language to the mass media so that we can correct at least the way that they're phrasing things and putting maybe non-intentionally or intentionally. We don't know exactly what intents are, but the point is it's time to educate more media personnel to at least augment the stigma. Another point is that the increasing rate, the 500 plus percent increase in the last decade has been around for the longest time. Since 2020 up to 2022, it has been 400%, 500%. And when it comes to the new cases, but one thing that we need to emphasize, maybe true, it is true. It is because of the more intensive HIV testing that we've been doing. And then also we have to look at the population that we are focusing too much on when it comes to testing. So the target from the Global Fund and all the other international funders are focused more on key populations, and key populations, particularly men who have sex with men, transgender individuals, and also other key populations such as young key population, sex workers, people who use drugs. So these are targeted testing. So therefore, we will, logically speaking, will be getting a lot of cases from the key population. In this case, MSM has been the highest proportion when it comes to the new cases. So it's true that the men who have sex with men are the ones with the highest number of HIV cases, but also at the same time, we have to understand that the program intends to specifically focus on these key population. But when we start to normalize HIV testing to the general population, just like for example, many other hospitals and HIV facilities are normalizing HIV testing for the general population, particularly men in general, men between 15 to 24 years old, and also pregnant women. So this now will somehow normalize HIV and also address the stigma that has been placed on the queer community. I don't know if I'm making sense or if it answers the question. I hope it does.
I have a follow-up question on that. Do you feel na it gives sort of like a false sense of complacency with people who do not belong to the queer community, with people who are not having, like men who are not having sex with men? Because you said na very targeted, the testing that's happening. It's mostly for men having sex with men and drug users, and all of that. But at the same time, like HIV is not just for these communities. It affects everyone, right? So for people na who do not belong to these communities, do you think na they are more complacent about HIV, that they're more complacent about testing and also like STDs, I guess? Would you say that?
I think it has a lot to do with perceived risk ng ating population. Because when I say, for example, if I were a straight man and I don't see myself as in high risk of getting engaged in unprotected sexual intercourse, then I don't see the need to go through HIV testing. So complacency, it's hard to tell then when it comes to the intent of our clientele or our clients. But I would always look at the better side of things, siguro. It's more about their perceived risk and also their health behavior and also their health seeking behavior particularly.
My personal take on that is growing up here in the Philippines, I've always seen condoms as a contraceptive. So it's something that I do so that I don't impregnate someone, or if I'm a woman, I don't get pregnant. While it is also true that condoms are the most accessible and most effective way on how we can prevent sexually transmitted infections in the Philippines, while we have some memorandums and circulars coming from CHED and from DepEd, to introduce sexual education in our schools, it's not being implemented as it should. So why as an MSM, for example, why will I use a condom if I'm going to have sex with another guy and none of us will become pregnant? But studies, particularly behavioral, the IHBSS, so it's a type of survey that's being conducted in the country uh, every now and then. You will see there what we call the condom gap. Normally Filipinos, or particularly the key population, would start and have their sexual debut at around 16 years of age. And then the first time that they will learn about how to use condoms properly is around at 18. And then the first time of using a condom is already 2 years after their sexual debut. So these types of information we get from the internet, from friends, but majority of the times of Filipinos is spent inside schools. And we could have started educating everyone about being safe. Sexual education doesn't have to be vulgar. So there's what we call age appropriate sexual education. So things like that could prevent. Complacency comes from a point of not knowing. Maybe it's because these people doesn't know the risks that they're taking. They don't have what Rod mentioned, health seeking behavior related to their sexual health.
So Mark, can you walk us through yung cookbook toolkit na you presented? Like, can you explain to us what this is about and what spurred you to actually create this toolkit?
Yeah, so maybe I can actually relate it to the note to what we're saying. More testing services are available because back in 2015, the testing modalities available in the country is very few. So, for example, a certain social hygiene clinic will set up a testing in the community in the barangays. They will bring volunteer workers. They will bring a medical technologist so that they can perform the testing outside of a facility setting, and then people will gather clients who wants to get tested. And that's the same model being implemented across the country. But come 2016, we have what we call the community-based screening introduced as part of uh, how to provide differentiated services to the Filipinos. So community-based screening allows lay people to conduct HIV testing outside of the testing facility. So I can provide the HIV testing, motivational dialogue, even at the comforts of your home while I have my test kit with me and we talk about it. So that became a starting point of the creativity of how we can access and provide access to the clients who wishes to get tested for HIV, because there is what we call the differentiated service delivery. Differentiated service delivery is more like we recognize that there is no single approach to deal with the epidemic that we have right now. So it will depend on what is the capability of the service provider, what is the interest of the communities that needs the testing, and what is the challenges faced by a certain group of people. Given that the Philippines has 7,000 plus islands, it already provides us with too many nuanced situations. So there are places in the country where it's easier for a queer young person to be open about their sexuality, whereas in some locations in the country, it's a sin to be gay. So given the number of different situations, here comes the cookbook. And before the cookbook came about, the manner of how people are implementing activities is based on what they know and they adjust depending on the situation. But having a nationwide scale of operations for SHIP in our current project right now, together with the Global Fund, we are able to have a network of uh, 26 different supervisors operating in 18 different regions of the country. And what works for one region might not work for another region, but might work for some. Therefore, it allows our implementers to record their accomplishments, cite the procedures that they're doing, so that if another group of implementers would want to do something similar to testing during a pageant, for example. So, uh, pageants are big in the Philippines, so we love pageants. And a lot of key population, members of the key population watch barangay gay pageants. So some would want to what would want to try and conduct testing during a pageant, but they've never done it. However, looking into the cookbook, there are certain recipes which, oh, if I read through the recipe, I know the ingredients that I need. I know the step-by-step procedure and how to implement testing during a pageant. Therefore, it's going to be easier for that new team to implement the same activity. Because back then, the only way for you to do that is either to experiment or to experience it firsthand. So right now, by having the cookbook, it's a collection of different key population specific strategies that lists down materials, length of preparation, step-by-step procedure, so that they can also replicate activities that are working. And also, we can use that as a starting point for evaluating whether our strategies are working or not. So it's a multi-fact toolkit that allows replication of the best practices across all of our implementing sites.
That's great. Rod, I want to talk about hashtag telePrEPph. So you've been leading the efforts on PrEP, encouraging people, like specifically Filipino MSM, like men having sex with men, and trans people to use PrEP. So what have you seen were the biggest barriers sa PrEP uptake in these targeted communities?
From our national data from the Department of Health, the most current PrEP uptake are highly concentrated in Metro Manila and regions considered as Category A. Category A meaning that they are the regions with the highest new cases, highest percentage of new cases of HIV. Therefore, these regions or these cities or municipalities require a more aggressive preventive approaches. Hence, marami yung nag-access ng PrEP sa areas na yun, leaving other remote areas, leaving other parts of the countries not having that much of an access to PrEP services. Say, for example, there are several regions in the south, Cagayan de Oro, Davao, especially in the regions where it's highly conservative, but then people are still doing, or should I say, engaging in behavioral risks of unprotected sex or having injecting drug use. So these are like clients who require or need PrEP the most, but then don't have access to it, right? So that's where the telePrEPph came in. So it originated with the intention to decongest one clinic in Metro Manila in Makati. So this is rolled out by different sale clinics. Currently, we have four sale clinics. We have a sale clinic in Makati, sale clinic in Caloocan, sale clinic in Trece Martires, Cavite, and also sale clinic in Calamba, Laguna. But primarily sa Sale Makati, we cater to a lot of clients accessing PrEP per day. But then because of the manpower that cannot are limited only to cater an X number of clients for PrEP, some of them cannot access PrEP on the day that they want to access PrEP or to get PrEP. Hence, telePrEP was created. It's a program wherein you can schedule a hotline counselor session, and then the hotline counselor will reach out to you and then start asking and assessing the risk that you have. And then if you want to start on PrEP, then you will be sent first with an HIV self-test kit, and then you will get your HIV test at the convenience of your own home. And then after you get the result that is HIV negative, you send it via Viber or via email, and then the hotline counselor will send a bottle of PrEP so that you can start wherever you may be. So this is a very big help in augmenting and decongesting Sale Makati. But then it started to reach other clients outside Metro Manila. It started catering to clients from Cebu, Romblon, Leyte. So it's now starting to become a different approach, a standalone approach on its own, wherein you can directly access PrEP, not because you just want to be decongested from the clinic, but also you are located in a remote area and then you want to really get access to PrEP. There's no limitations now, right? It addresses the barriers of geographical locations. and at the same time, it's considered then differentiated. So it's a big thing for sustained health initiatives of the Philippines to really advocate for differentiated service delivery models. So, dadagdagan ko lang yung sinabi ni Mark kanina na ang differentiated service delivery is just providing several options so that we empower our clients to make that informed decision on the kind of treatment or prevention that they want, suited to their preferences or their needs, right? So it's also known as a person-centered HIV prevention or person-centered HIV care kasi it really respects the client's autonomy in terms of what kind of program or treatment that they want to access. So Sale telePrEPph is going to address these needs, personalized needs, and overall sa ating pilot implementation, 9% approximately 9% pa lang yung nakakapag-try ng telePrEP. This is the data between 2021 up to 2023. So medyo limited pa yung data natin sa telePrEP na evaluation. Siguro yung summary lang nun ay yung 9.8, approximately 9% of those who access PrEP from the 5,000 clients that we have, sila ng PrEP persistence up to 86%. Meaning na mas nakaka-adhere sila sa PrEP medication. And sa lahat ng data na lahat ng data limit natin sa duration ng 3 years na yun, 2 years, 21, 22, 23, 3 years. Sa 3 years data na yun, nagkaroon ng analysis na zero HIV conversion. Walang nag-HIV positive sa mga grupo na nakapag-access ng PrEP from the telePrEP approach. So it's a very good program, should I say. Ngayon, inumpisahan na natin sa pag-analyze yung data, yung lahat ng data from 2021 up to 2024. At sana makapagkuha tayo ng ano.
How do you participate? Like if I'm interested, like let's say I'm not close to a sale clinic, but I'm interested in participating in the program. Like how do I access this service?
This is the part that I will shamelessly plug the Facebook page of Sale telePrEP. Pwedeng bisitahin ng ating mga kaibigan na nakikinig sa atin ngayon. They can find the information from Sale telePrEP, SAIL tele TELE prep. It's really it can be easily found in sa Facebook and also sa Instagram din, and also I think Twitter din. They can find the hotline number there, and then they can just call it right away. Or there's also a website where they can book a schedule kung kailan sila pinaka available to have a conversation with the hotline counselor. And then that's easy as that. So the hotline counselor will just contact them wherever they are, and then mag-ipaprocess na rin yung kanilang self-testing ng HIV para makakuha na away.
And the medication is sent to them directly. Do they shoulder the shipping cost?
Right now, it is funded by Elton John Foundation, John AIDS Foundation. So the courier fees are covered for free. So since it is an operational, should I say, implementation evaluation as well. So ini-evaluate natin yung widened na access ng PrEP through telePrEP approach. And dahil dun ay covered siya ng Elton John Foundation.
And I assume like when it gets sent out, the discreet yung packaging so people won't know what's inside, or may way ba?
It looks like a brown, very simple package. It looks like it's an order from Shopee. So it's super discreet, no? And it's not really nothing. No information is written on the box. Only the name of the client.
I assume, like, for example, a teenager wants to access this service. Let's say, like, someone who's 18, probably living with his parents pa, wants to access it, but is scared na their parents will find out. They're getting PrEP, diba?
Yeah. Super discreet, yes. So walang ikakabahala yung ating mga bagets kung sila na mag-access ng PrEP.
So balik ako kay Mark. Anong policy bottlenecks did you see that require changing? So how can civil society and local governments work together to sustain yung changes with everything that you're doing? How can they change what's currently happening right now?
So in terms of the policy landscape, firstly, we already have, I mentioned here na meron na tayong CHED and DepEd memorandums that allows or that asks for schools to implement a sexual education in their facilities.
This is in the absence of the law. Like schools can actually do sex
So
education programs.
additionally, we have our HIV law in the country has been repealed. So back then it was 8504. Right now we have what we call the RA Republic Act 11166. Actually lowers the age of consent for people to get tested. Back then, you have to be 18 years old and above before you can get tested without your parents' consent. However, recognizing that 15 year olds and up, there are situations when they are already consenting to sexual activities, but it's becoming a barrier that they need their parents' consent before they can get tested. So this law, the RA 11166, lowers the age of consent so that um, young key population aged 15 and up can get tested even without the consent of their parents. So that is for the testing alone. But additionally, learning about HIV, learning about comprehensive sexual education is not something that is illegal in the country. It's a matter of absorption of the implementing agencies, for example. So for Dole, there are laws that there are certain regulations that asks us if your company has this number of employees, you need to have a comprehensive HIV policy in your workplace. So there are things like that, but it's the manner of how these are being implemented by the people who should be implementing them. So ship, the way that we augment that through our field staff is that we are accepting different partnerships. Some workplaces, some BPOs, some factories would invite our team to visit their location and provide them HIV awareness, testing activities. With the Sangguniang Kabataan all throughout the country is also asking us to partner with them and conduct awareness activities, HIV testing activities together with their constituents. So right now, the Philippines is ready in terms of prevention and reach. It's just a matter of making it happen because the catalyst to allow that to happen is already present. However, this is where it gets tricky. So while our HIV testing has been lowered down to 15 years of age, for a person to get access to the treatment for free. And there are no other ways to get antiretroviral therapy in the country apart from getting enrolled in an HIV treatment hub. And for you to get enrolled in an HIV treatment hub, you have to be enrolled in PhilHealth. And PhilHealth, if you are a minor, it automatically ties you with your guardians, with your parents.
Mhm.
So if a person, let's say it's 15, 16 years old and gets tested and it turns out reactive and gets a positive result, there still comes a time that that individual has to consent, has to ask for their parents' consent so that they can access their child health package so that they can enter into treatment. But that's where the role of our staff, our support groups come into play. So we have a lot of people helping these newly diagnosed individuals so that they can come into terms with their parents on how to come out and ask about getting enrolled into treatment. So we have several activities, we have several programs, we conduct family development sessions, but I, I'll go back to it's really the implementation of the laws and regulations that we already have, because sadly there are times that it goes back to the preference of a person who has power over a certain area. For example, a university administrator will not allow HIV testing because they have different beliefs and values. So it will already become a barrier for everyone who could benefit just because of a single person's bias. But unfortunately, that single person has that much power that they can prevent having activities conducted in their area. So it comes into play. A lot of politics are happening, but in terms of laws and policies, we have them available.
I see. So, as my last question, what should the media do to one, not discourage people from getting tested, and to also become sensitive with the way the issue is being treated? Like how can the media do better in terms of framing this issue?
This is where the media should be reaching out to community-based organizations and also reach out to people with vast experience on HIV awareness campaigns, and also trying to get educated with the person-centered language because it's available. It has been recommended by the People's Charter and also advocated by several international organizations and specifically, well, International AIDS Society or IAS. And also, we've been spreading this people-centered language website ng SHIP and among our networks as well. Siguro lang kinakailangan lang ng media na makinig sa civil society organizations and community-based organization para at least ma-frame ng maayos yung question, narrative on HIV prevention sa Pilipinas. On top of that, siguro yung pagiging humane ng media. We know that we would like to be viral on social media. We know that we have to get people's attention, but we can get people's attention if we're using compassion or where we're using humanity as an angle. That's one aspect among other things. Ang dagdag dun sa sinabi ni Mark kanina, i-backtrack ko lang ng konti if it's okay, if we have enough time. Aside from the advocacy work that SHIP staff has been doing in the different front lines ng Pilipinas, there's also the SISE program, which we have talked about offline before the start of our podcast. No? The SISE, the psychosocioeconomic support, is a form of training and at the same time a form of improving and widening the healthcare providers network. In a very, well, should I say, in a biomedical sense, an HIV care facility requires to have a medical doctor, a registered nurse, and also a frontline case manager who is ideally a person with lived experience, meaning that they are also coming from the queer community or they can also be a person living with HIV in order to have that complete set of biomedical intervention. But for the SISE program, the psychosocioeconomic program expands that further. And in an ideal world where we are providing holistic HIV care, we should start involving the education or the educational institution, also social work and social workers, Department of Social Welfare and Development offices, and also mental health division of the Department of Health to include mental health practitioners, psychologists, mental health doctors, and social worker para makapag-augment dun sa problema kanina ng youth na hindi makapag-start ng treatment dahil walang consent yung ding si social worker yun ang pipirma. And in fact, meron na tayong na-train social worker under the SISE program, and they're fully aware now that their responsibility can also extend as a proxy consent signatory para makapag-start ng treatment ng ating mga young people living with HIV who got diagnosed at an early age. And on top of that, to address naman the problem of PhilHealth, hindi nakapag-access young person living with HIV ng PhilHealth, pwede siyang i-link sa social welfare department or medical social welfare ng isang hospital, or nililink siya sa municipal social welfare department ng isang munisipyo or syudad para makakakuha ng approval so that they can be given a financial assistance so that they can start with their baseline labs, and the PhilHealth can just be processed later on. What they need to be doing is to start the treatment right away. So we have already addressed that from the front line, and SHIP has played a major role in addressing that. And we are now in the process of evaluating how it can strengthen the referral and the holistic care through our memorandum of understanding with Iloilo Province. So we are piloting this SISE network in Iloilo Province. The example that I gave about the social worker signing on behalf of the young person living with HIV to start treatment. These are all part of the training program, and at the same time, it can be strengthened further by a local government ordinance. So bringing back to the question about how media should be framing the narrative or structuring their news, dapat comprehensive. We go beyond the numbers. We go beyond the data. We start looking at what exactly is being done in the front line so that they get a comprehensive understanding that we're doing something about it. And also to address the stigma against the queer community, kinakailangan din ma-highlight din yung stories na mga hindi queer so that there should be like a leveling off, and the HIV equally affects everyone regardless of being queer or not. So this is what the media should be doing. I hope it answers the question.
So ako, I'll start with what we call the whole of community approach. So it's something that talks about this is not just a medical concern. One of the main reasons why we changed the law from 8504 is because HIV was only seen as a biomedical issue. But on 1166 updated the law, we actually inserted the human rights aspect of HIV in the Philippines. So, how do we now tackle this challenge of the increasing the numbers? I would say go back to the basics of how HIV is being transmitted. So, it doesn't talk about a person's gender identity. It doesn't talk about a person's sexual assignment of birth. It doesn't talk about a person's soji, their preference. It's actually if you have an exposure, you get tested. It doesn't matter whether you are queer, whether you're straight. Let's not attack the person. It's what we do that puts us at risk. It's not who we are. So go
Mhm.
to an HIV testing facility if you've had any of the modes of transmission, if you've had unprotected penetrated sex, if you injected and shared needles with other people, get tested and learn about what's happening. If not, there are a lot of different um materials you can review online. There are a lot of people who can share their information about what HIV is so that one of the ways on how we can deal with stigma and discrimination is really knowing and learning more about what's actually. So definitely it's beyond the numbers, but everyone has a role to play with what's happening in the country. The numbers I don't believe will go down as fast, but we've been, kumbaga, there's a long way to go, but we've already done so much. So I hope this recent news opens opportunities so that we can have better programming. It wakes people up about the actual situation. Let's not look at certain populations only, but rather let's look into ourselves and see whether do I need to access the services for HIV? And if yes, go ahead, get tested. If not, learn more about it so that you can see and you can understand how to prevent more infections from happening. So maybe there's a long way to go for the Philippines, but right now it's good that a lot of people are learning more about HIV. So there are 299 HIV testing facilities. We have the telePrEPph available wherever in the Philippines you are. If you access that link in the Facebook group shared by Rod earlier, you will be able to access the services that we are providing. I'm actually here in Cebu right now. We had a meeting with Cebu City Health Office and we are setting up together with the Center for Health Development, the DOH Regional Office of Western Visayas, oh sorry, of Central Visayas, to set up a headquarters here in Cebu. So we're opening more ways on how people can access the services. It's a matter of them accessing the services so that they can learn more and get protected. And I think that's it.
Yeah, that's great. And I think what you said nga na, and maybe just to sort of summarize that, pero malayo nang narating natin, di ba? Like from when we started, when the issue really blew up, we've gone a long way, but there's still so much we can do to actually encourage more people to get tested, prevent getting HIV, and yeah, helping the queer community battle this epidemic. So thank you, Rod, thank you, Mark, and I appreciate the time that you gave me to conduct this interview. And I hope to speak to you again soon.